and Senator Murray's leadership. And as he mentioned, thanks Senator Murphy for his collaboration in passing this. I will speak to mental health as a senator, but also as a doctor, as a family member and friend of those with mental illness. And because of this, these different hats, passing comprehensive mental health reform has been a priority since day one. Senator Chris Murphy and I introduced the Mental Health Reform Act of 2015 shortly after arriving in the Senate. Again, since then, Senators Alexander and Ranking Member Murray have made mental health reform a priority, and I thank them once more for their vital work to include the provisions the four of us introduced in the Mental Health Reform Act of 2016 into the 21st Century Cures Act. Everyone, in some way, is affected by serious mental illness. This is not a partisan issue. It crosses any division of age, gender, demographics, and certainly a political party. If I go to a town hall meeting in Louisiana in an area not so wealthy and speak of the need to address mental health, heads nod yes. If I go to another town hall meeting in another area very wealthy and mention of the need to address mental health, all heads nod yes. Everyone nods their head yes because mental health is an issue in the minds of everyone. I mentioned earlier, everyone has a family member or friend who has a serious mental illness. Maybe not, but it might be that person you went to high school with, and her life turned out far differently. Her marriage broke up, her children in foster care, perhaps she homeless. If you think not even hard, that person will come to your mind. The largest problem affecting Americans with serious mental illness is lack of access to care. Just a few weeks ago, I spoke to a neuropsychologist in Baton Rouge, Dr. Paul Dammers. He told me he sees 15 to 20 patients a day and is booked up to 6 months in advance. If your loved one is having a mental health crisis, they should not have to wait 6 months to receive treatment. He stressed the significance of the barrier to treatment posed by the shortage of mental health professionals. Thank God for Dr. Dammers, for all the work he and the other mental health specialists do to help those with mental illness return to wholeness, but they need help. Access delayed is access denied, and access is hampered by a shortage of mental health providers and too few beds for those with serious mental illness who need to be hospitalized. Patients too often cannot get the care they need and too often have a long delay between diagnosis and treatment. And without appropriate treatment options, prisons, jails, and emergency rooms become the de facto mental health care facility. Sheriff Greg Champagne from St. Charles Parish, Louisiana, a past president of the National Sheriff's Association, quotes the statistic that sheriffs are the #1 provider of mental health services in any parish or county in the country. Incarceration has become our top mental health treatment strategy. More than 3 times as many mentally ill are housed at any one time in prisons and jails than being treated in hospitals. Now, it is clear. It is time to fix our broken mental health care system. The 21st Century Cures Act provides incentives to build an adequate and skilled mental health workforce, to expand access to mental health care, providing quick and effective diagnosis and treatment. Our goal is that that person who has her first psychotic episode when she is 18 will be restored to wholeness so that when she is 50, she looks back upon that as a distant memory, but not as a life-defining event. This bill also addresses privacy issues that keep some patients from receiving the best treatment possible. As an effect of the government regulation HIPAA, an important law protecting patient privacy, nonetheless, when it comes to a patient with mental illness as an adult, the doctor feels as if she or he is not allowed to share vital information for their care to a third party, even if that third party is their caregiver. And a woman I went to high school with has an adult son who has serious mental illness. And she relates, she's the one who brings him to the hospital, she's the one who gives him his medicines. And yet, when he's discharged, she's not told what medicines he takes She's not told when to take them, and she's not told when to bring them for follow-up. Privacy is important, but when government regulation gets in the way of a doctor and a patient and a family trying to make sure that their loved one is cared for, something needs to change. This legislation also provides incentives to build that adequate, skilled mental health workforce, but also train that workforce to better understand these rules of disclosing patient information. This allows doctors to better serve their patients and ensure they're getting the proper care they need. It also, this is, again, as a physician, this next provision just matters so much to me. It promotes access to services through the integration of primary and behavioral health. Now, right now, if someone with serious mental illness goes to see their psychiatrist, and the psychiatrist notes that their hypertension is out of control, and she wants to send the patient down the hallway to see her colleague, the family practitioner, federal programs won't pay for that. She refers them to the emergency room instead. Conversely, the family practitioner treating the hypertension notes that the patient's psychotic. They're not allowed to send the patient down to the psychiatrist on the same day. Now, in private insurance programs, this is not an issue. It's only been an issue in Medicaid. This law begins to change that. And I will note that patients with psychiatric illness die 20 years younger than do patients who have a physical illness but do not have a psychiatric illness. We must do better by those with serious mental illness. Another thing this bill does is to establish a grant program focused on intensive early intervention for children who demonstrate first signs that may evolve into serious mental illness later in life. Doctors Howard Osofsky and Joy Osofsky of LSU Health Science Center in New Orleans did research after Hurricane Katrina and found that you could detect from ages 0 to 3 evidence of a child who may have a problem with mental illness later in life. This bill provides grants for early intervention for the infants and children that will address the effects of trauma and the adverse experiences that up to 10 to 15% of children under the age of 5 have. A second grant program supports pediatricians consulting with mental health teams. This is modeled after a successful program in Massachusetts and Connecticut. This legislation does many important things to change how we treat mental illness by expanding access to mental health resources, clarifying the rules on disclosure of patient information with family caretakers, and integrating primary and behavioral health. The 21st Century Cures Act will begin to fix our broken mental health system and prevent more people affected by mental illness from being denied the care they need. Thank you, and I yield back.
Mr. President.